Good afternoon, everyone. My name is Odmaa, and I'm a PhD student at Messi University. And today I'm very pleased to present my paper on no pains, no gains, mining pollution and morbidity. So this is a joint work with Saeed Hassan and Martin Barka, and we would very much appreciate your comments on feedback as it's an ongoing work. So I would quickly start with the research question. And in this paper, we ask whether pollution from mining activities costs the nearby communities a certain health burden. So in answering this question, we undertake the first study to use unique soil pollution data from a resource-rich developing country to estimate the impact of exposure to mining pollution. And we provide evidence on different age groups, body systems, mine scales, and mineral types that have not been studied in conjunction in a holistic approach in previous studies. So the finding is that if you live close to a mining area, you would benefit greatly by increasing your distance from the mine. For example, moving 1 kilometer away from a polluted mining area reduces your probability of being sick by 11%. And we also find that the younger people up to the age of 14 years are most affected, which is consistent with other studies. And also respiratory illnesses seem to be more aggravated in communities nearby mining sites. So overall, the results indicate that mining activities create significant negative externalities to nearby communities. So how does natural resource extraction affect communities? Well, we all know that mining industry has a significant potential to bring revenues to the national governments and bring employment and spur economic growth at the local level. But it's just an expectation. But there's a big trade-off between economic gains as well as other environmental impacts and health impacts. So pollution coming from the mining sector is a form of negative externality to the communities. For example, for every kilogram of gold produced, 1.3 kilograms of mercury is dumped into the environment, and it pollutes the air, water, and soil. So it's an important area to look at to understand whether mining communities are actually affected by this pollution. So there are 3 forms of pollution that can affect human health. First is air, and then water and soil. And as we all know, mining uses different types of chemicals, and there is a significant amount of dust in the air, and all this go to water and soil, and these different types of forms of pollution have significant negative impact on communities, both showing carcinogenic and non-carcinogenic risks. And a person can be exposed to pollution through 4 different factors. The first factor is how far you are from the pollution source. And the second is maybe you can be exposed to pollution for a couple of months, whereas other people can be exposed for a lifetime. And also the type of pollution, whether you're exposed to lead or whether you're exposed to mercury, can have different types of impact, and your body will have different response to these types of pollution. And lastly, level of pollution is important because environmental protection agencies around the world set certain thresholds. It's still levels that are below the thresholds seem to also threaten the health of local communities. So there are many empirical studies in developed countries, mostly on air pollution, but there remains a limited evidence on the impact of mining sector in resource-rich developing countries. And there are only a handful of studies done in Ghana, Chile, Colombia, and other resource-rich developing countries. And these studies found that mining pollution decreases productivity, affects children's math and language scores, and even there is a significant impact on anemia in women and stunting in children. So there are impacts, but these studies have not really made use of soil pollution data. So therefore, our study tries to bring new evidence on this front. And in order to assess the impact of pollution, we use a simple OLS model using Woolridge and Nadel. And here our dependent variable is a dummy variable that takes the value of 1 for individuals who felt sick around the mining areas, and 0 for those who didn't. And our main variable of interest is distance to the nearest mine, and this is the variable of exposure. And we are looking at mining sites where there have been 7 different types of heavy metals recorded, and distance is the only variable that actually captures the effect of these 7 types of heavy metals. And we include sub-province fixed effects, survey fixed effects, and individual specific control variables, and also run additional models, but because of time constraint, I will only focus on this. And there are some endogeneity issues that we need to consider in this causal inference. These are avoidance behavior, residential sorting, and omitted variables. People take certain measures to avoid pollution because they know that it's going to harm their health. And some people, if they are able to afford it financially, they also move to cleaner location to avoid pollution permanently. But this kind of behavior depends on public information as well as visibility of the pollution. And in our case, in resource-rich developing countries, especially soil pollution, monitoring is not very well done, and people are also not very much aware of this issues. So we don't consider this as a significant threat to our empirical specification. And because we include sub-province fixed effects and survey year fixed effects, some of the omitted variables are also taken care of. And here I'm showing you the geographical distribution of the sample points across the country. And in the blue triangle, we are seeing the statistical areas for the household survey data that we are using. And in red circles, I'm showing you the level of mercury found in different sample sites. And this comes from the Ministry of Environment and Green Development. And these soil samples were taken around mining areas across the country in 2012. And we are focusing on only those within 6 kilometers of a residential area. So our morbidity data comes from 5 rounds of Mongolia Household Socio-Economic Survey, and it's a nationally representative survey which reports self-reported illnesses from various body systems, such as respiratory, digestive, and other body systems. And we also have individual specific control variables such as age, gender, education, and consumption per capita, and urban-rural status. So here is the result from the empirical model. And we have undertaken 2 stages. Like first is the baseline results without any control variables, and then we add the control variables to our specification, which is our main model. And we have used a linear probability model, probit, and lodged models, and they all give significant and similar results. So if I interpret the coefficient in column 6, here we can see that if you increase your distance from a mine by 1%, then you are 1.4% percentage points less likely to feel sick, which is around 11% reduction in your probability of feeling sick. So this is our main result. And then we move on to additional hypothesis, and we examine whether medical expenses are also affected by your sickness. And we find that as you move away from the mining areas, your medical expenses seem to also go down, which also reflects that people closer to mines are also falling more sick. And we also examined the different age groups. And here we have children, working age population, and older people. And as you can see in the last column, the impact is actually highest for older people. But because of smaller sample size, it's probably not significant. But here in column 1, you can see that the impact is significant for younger children. And this is expected as they have smaller bodies weight, and they have more frequency with soil, and also they have weaker immune system, so they are suffering the most. And then we look at different body systems and their responses, and here we find that respiratory symptoms are most aggravated by exposures to pollution. And next, we look at whether mining license holders, those are medium to large scale mines versus small scale miners, and their impact is definitely different. So we find that the impact of small scale mines are significant and bigger than large scale mines. And this is because large scale and medium scale mines have certain land especially licensed to them, whereas small scale mines have a big area of land belonging to many people, and it's like a common resource. So there's a tragedy of commons thing going on. They are not very responsible, and they are mostly individual miners. Some of them are not even licensed, so their environmental footprint is very obvious. And lastly, we look at different types of minerals mined across the country. Those are gold, limestone, and other minerals. And we can see that in column 2, the impact is significant and very high from gold mine. And this is also expected because gold mines are widely located around the country, as well as these mines also use heavy metals such as mercury to extract, and actually use mercury to get the gold from the rocks. So there is the impact coming from the gold mines. And so our results are overall that, and our results are robust to alternative specifications such as linear probability model, probit model, and we have also used the instrument variable approach and principal component analysis. Even though we are using OLS as our primary model, our results are robust to these different specifications. And if I have time, I'm not sure how much time I have left.
I'll give you 2 more minutes. Okay,
so we have looked at also an instrument variable approach. We used the price to lease dwelling, so it's like household heads' perception to rent their house if they were going to rent their house to someone. And then we use this as an instrument variable for the distance variable, because this doesn't really affect the probability of feeling sick directly. And here our results are consistent, but the coefficients are much higher, and our instrument variable meets the requirements for the valid instrument. And yeah, so the key takeaways from our study is that mining pollution affects the nearby communities, especially the impact is very high on younger children, and mining pollution aggravates respiratory illnesses and increases medical expenses. We also find that small-scale mines and gold mines significantly affect sickness. So if we put these study results into perspective, over 8,700 people would not have felt sick if they were a kilometer away from mining sites. And the policy implication coming from this study is that better environmental regulations in resource-rich developing countries will have great economic and social benefits for the communities affected by mining industry. Thank you so much for your attention, and I look forward to your questions.